It's just outrageous.
No.
Also, like that kid in the news with cornrows that are apparently radical, so radical his school sent him home. What is going on in our schools? Because these messages are really out of date. Like,
Well, they've backtracked
really.
now. They've backtracked.
I know they have.
Yeah, Patrick Smalley, what's your thoughts?
Oh, I was really hoping that they'd have the press conference because I don't want to touch this with the barge pole. But broadly speaking, I thank you, Michelle, for making the point about the male teachers. I mean, it's not only that it's kind of insulting to the girls; it's also insulting to the male teachers. We all live in the world and dress and so forth and do as we please to a large extent. I think it's more an issue about formality and appropriateness and if you decide that your school is going to have some level of formality. I mean, it sort of takes me back to when they introduced Casual Friday in a corporate environment that I used to work in a few years ago, and within about 3 or 4 weeks it was like being in a tramping hut, and steps had to be taken.
Look, Michelle, another panellist member and political commentator, Ben Thomas, tweeted today, quoting, "I wish middle-class kids would stop believing that their high school dress codes and haircuts are crucial human rights issues." What do you think?
Respect to Ben. I get what he's saying, but I do think that's a bit reductive because it's about more than that. It's about your own personal autonomy and the way that you see yourself as a young woman, and what you're being told and modelled by educational systems is a distraction to your learning by one saying you might be tempting men, who knows what they'll do if you wear that singlet. It's completely out of place at a school. But moreover, if these are going to continue to be such issues, then surely conversations around having uniforms or, dress codes as these girls are doing should be put in place, because we all have a personality. You have a personality from when you're born. You have an identity, and it is expressed, whether you think so or not. It's cool. How you present yourself is a huge part of who you are, and having it governed in this way I just think it's really inappropriate.
Okay, yes. The Wellington Girls College has apologised, and now the students are being brought into the loop, and they actually consultatively doing a dress code together. So it's a bit of a win-win there. But gosh, Patrick, I can recall the dress codes when I was and people do know that I went to Nelson Boys College. They were strict. I mean, I got hauled over the coals for having a belt slightly too thick. Can you recall any dress code issues at your school?
Well, I went to Selwyn College, which was basically a school for hippies where girls went to get pregnant, or so I was told.
Oh, that's a ridiculous thing to say, Selwyn.
That's where I went. So we had mufti from like the fifth form. It was not that we call it mufti anymore, I suppose, but that's what we called it. And we dressed appallingly when I think about it. But nobody told us to stop wearing whatever it was that we were wearing. I think we were a ghastly sight. I mean, both male and female teachers had difficulty coping with what we had
28-5, we await the media conference with the Prime Minister and Dr. Ashley Bloomfield on the alert level. So we will cross that as soon as we can. Just a bit of feedback here, and regarding actually a big on rent control. Don says rent control. Patrick Smalley talked about this. Michelle, with the State of the Nation report, Salvation Army. Rent control, vital. I have experience of the way firms work when it comes to setting rents. They think nothing of increasing the rent 10% per annum, and then when I decline, they are shocked. The argument promoting high rents is, well, the market can support it. If a landlord is making more than 10% per annum after tax expenses, then she should be brought back into line. Another one says rent freeze belongs in the Muldoon era. I cannot believe your commentators are so serious on this.
Well, I mean,
yours faithfully a residential property investor.
Okay,
but they're out of control. It's unsustainable. People cannot afford to live. At what point does the government go, okay, this has escalated. People cannot afford to live in clean, dry homes, and we need to do something? Like, what's the tipping point that makes it okay for a government to intervene? We've got a massive housing crisis. We've got a huge amount of poverty in this country. So when is it okay to do something about it?
And the Salvation Army guy made the point that Kaingaroa could be building a lot more houses, and I think we'll probably see that in the budget, and that is ultimately the best way to control the price of houses, is to have too many. because then you've got an oversupply and the price starts to come down anyway. But that takes a lot of time, and we've taken 30 years to create more, probably, to create
It'll be
this
very
issue.
interesting to hear. We might sort of follow that up on the panel another time, whether or not rent controls might be a part of the mix in the future. Doesn't New York have some form of rent control for certain places, Michelle? That's what I heard anyway.
Yes, that's true, and
Yeah.
can have an incredibly perverse economic impacts, but we've got incredibly perverse economic impacts occurring in our rental market at the moment.
No.
Yeah.
Michelle?
No, I throw my hands up with this because on the one hand, I just really acknowledge that I'm out of my depth in understanding the way the market influences this stuff. But on the other hand, I see real genuine need and people in distress, and it's kind of, it's a losing game for a lot of people right now.
Big response regarding scanning and incentives for scanning. Gamification is a well-tested way to make people do the right thing. Check out the fun theory from Volkswagen Marion from Auckland. Offering money just exacerbates the greed that has become endemic in our society. Another one here regarding prizes for scanning. That might not be a great way to discourage people from spreading disease. Probably could only use the system at level 1. Another one here. Are we spoon-feeding now? Surely the incentive to protect ourselves and our whānau is enough. I believe the proprietors of these places should be asking their customers to make sure they have scanned or signed in. No, says someone. 10 packets of toilet paper and the scanning will go through the roof. That's not a bad idea.
Yeah, I don't personally agree with the incentivizing. Like, I think it's
You
something
don't?
we could all just. No, I don't. Like, I mean, I understand it in theory, but I just think we could all just make a bit more of an effort. And if you are going into stores and there is someone there who is a staff member who is prompting you, you are more likely to do it. This is just something that we could all just get on board with and not need people twisting our arms to do it. We're all, I was going to say we're all adults, but a lot of the population in New Zealand are not. But you know what I mean.
Patrick, response, would you support it? Some sort of incentivizing of...
I sort of got talked out of it by Andrew. I think that anything which made people actually go to more places to scan in more often to increase the possibility of actually winning something that would be completely self-defeating.
Yeah.
I'm a landlord, says one, but don't feel that I need to automatically raise rents every year. How much profit does the landlord need? Then there's still the tax-free capital gain. Bring on rent control. There is no other way to make landlords do the right thing, says this landlord. I pay for $540 for a pretty rundown house in Wellington. I was in a tiny, mouldy house for $445. This is a massive part of my salary every week, and a lot regarding uniforms at school or dress at school. St Pat Silverstream, endless battles over hair length. The reason I didn't cut it for years after I left. That obviously worked to change my attitude, says Max. We are with Michelle Langston this afternoon, also Patrick Smelly, and we are waiting for the media conference with Prime Minister Jacinda Ardern and Dr. Ashley Bloomfield.
Kia ora koutou katoa. Good afternoon, everybody. We're now at day 3 of our COVID response plan, following the emergence of new community cases in Auckland on Sunday. Cabinet met after question time this afternoon to review our current alert settings, and I'll share that review with you shortly. But first, I will hand over to Dr. Bloomfield to provide the very latest numbers that we have.
Thank you, Prime Minister. Kia ora koutou katoa. So, as you would have seen in our 1 o'clock statement today, we've confirmed 2 new cases in the community, and in addition there was 1 new case in managed isolation overnight. So both of those new cases are linked to our existing cases that we identified over the weekend. In this scenario, and as we continue to investigate the source of transmission for these cases, we should be encouraged that all 5 of our cases remain in a tight configuration with clear epidemiological linkages. Both of the new cases are students at Papatoetoe High School. Case D is a classmate of the original case A, which was the 13-year-old girl who attends Papatoetoe High School, had already been identified as a close contact because she was in the same class and as such was in isolation. And case E is that new case's sibling from the same household. Both these two new cases continue to undergo case interviews at home and strict self-isolation, and as those interviews continue, we have identified a number of locations of interest that will be loaded onto the Ministry of Health website. We will also send out a media advisory with these locations of interest as that information is confirmed this afternoon. I can just now also confirm that a further member of the household of cases D and E has tested positive this afternoon, while the other two members of the household, which there are 5 members in total, have tested negative, one on Monday and one today. Scoping of any additional locations of interest is underway, and I should point out that the latest positive test of a member of this household, this person has been in isolation during their infectious period. It's also worth pointing out that the two cases, D and E, that we spoke about earlier today were asymptomatic when tested on Monday, and therefore have a lower risk of transmitting the virus on to anybody else during their infectious period. I recognise that these additional cases may cause concern for the school community and indeed across the wider community, but it is reassuring that they are all linked and were identified through the testing that was put in place specifically for this purpose. I really want to thank Papatoetoe High School, its leaders, staff, students and the wider community for the brilliant way they have responded to this week's developments. Their prompt actions, willingness to be tested means our system has been able to kick in as it should have and identify these cases. Just a reminder, of course, COVID-19 is an unwanted visitor. No one at the high school invited it in, and this situation demonstrates just how the virus can exploit any chance it is given. However, the possibility of finding new cases was something that we are prepared for, and the system continues to follow up as we would expect. I'm sure there will be interest in what's happening around the high school, around its reopening. So our original case's last possible date of exposure at the school was the 10th of February, now 7 days ago. And cases D and E, the ones we announced earlier today, were not at school during their infectious period. We are confident that contact tracing and testing of any school-related contacts has been robust. However, to provide all possible reassurance to the community, the high school will remain closed for the rest of this week and reopen on Monday the 22nd of February. I can confirm that all students and staff will be expected to have had a negative test result before returning to school, and indeed most have already done so. Staff, students and their households are being asked to work from home or stay at home for the rest of this week and to avoid large gatherings and inviting visitors around. Any close contacts of our existing cases, including the other students in the class who were identified as close contacts, need to remain and will remain in isolation for 14 days and will have a subsequent test before they are released. Testing is going to be available again at the school on Saturday and Sunday for any students who haven't had a test yet, and for any others of the community who would like to have a test. Of course, anyone who is symptomatic should promptly get a test as well. Our case investigation and contact tracing for these two additional cases is well underway. And if we think back on our original two cases, as at 3 o'clock this afternoon, the 31 close contacts from Case A and the 1,523 casual plus contacts were identified at the school. All of the close contacts, bar the one we announced today, have returned negative results, which is very encouraging. And in terms of the other students in the class, nearly 80%, that is 1,159, have returned negative results, and there are still 363 outstanding. So I can also say there were over 17,000 tests done or swabs taken around the country yesterday, many across Auckland. So this is very helpful in terms of us being able to rule out wider trains of transmission, along with our wastewater testing by ESR in Auckland, which has shown negative results. This is reassuring. Finally, just a message to Aucklanders who need to access health services. Under Alert Level 3, health services are open and you should attend any health appointments you have, and certainly if you have urgent health needs, do not delay seeking medical attention. All hospitals, pharmacies, GPs and urgent care clinics are fully open to provide care to people. And of course, anywhere in the country, if you're unwell with the symptoms of COVID-19, please call Healthline to arrange a test. If you are in Auckland and have symptoms, then you should call the hospital or clinic before going to an appointment. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Before I begin today, I want to say a word of thanks to everyone. When we were here on Sunday and shared the news that we would be changing our alert levels, I know everyone would have felt gutted. But everyone has put a huge amount of work in since. Between midnight Sunday and 10 a.m. this morning, I think it's a total now of over 23,000 tests that have gone through. We've also carried out wastewater testing in Auckland, and so far the results we have been negative. Since Sunday, 213,000 more New Zealanders have turned the Bluetooth function on their COVID Tracer app. And on Monday alone, there were just under 1.5 million QR code scans, because we all remember Bluetooth isn't enough, you need to keep scanning. And of course, Aucklanders moved back into their bubbles at a time when I'm told the weather was pretty miserable. While the re-emergence of COVID in our community is something no one wanted, it is something that we had planned for. When the source of a case is unknown, that plan is to move quickly and with caution, as we did on Sunday. However, it is also our plan to avoid using the alert level system to manage cases once we have a good handle on them. On that note, Cabinet has this afternoon reviewed the current alert levels. Based on our usual criteria, the Director-General of Health has recommended to Cabinet, and Cabinet has agreed, that as of midnight tonight, Auckland will drop down to alert level 2. As you've heard, there will be some exceptions for those who are connected to the Papatoetoe High School community, which I'll go into in more detail shortly. The remainder of New Zealand will move to level 1 at midnight tonight. Just a reminder, the definition of alert level 2 is that COVID is contained, but there is a risk of community transmission. The situation in Auckland most appropriately fits that level. These restrictions will remain in place until Monday, when they will be reviewed by Cabinet. My expectation is that we have a similar situation to what we have now, where we have cases that have already been identified as close contacts, for instance, then we should be in a position to move alert levels again. I want to stress to everyone that this is good news. Apart from the cases which have emerged today, all results of close and casual contacts, close contacts of the initial 3 cases have come back negative. What this tells us is that we don't have a widespread outbreak, but rather a small chain of transmission, which is manageable via our normal contact tracing and testing procedures. In terms of level 2 restrictions in Auckland, as I said, the one exception will be Papatoetoe High School, where we're asking students and the school community to do things a little differently. Students at the school, along with their families, are being asked to stay at home, and they will need to return a negative test before they can return to school on Monday. A quick reminder of what Alert Level 2 means for the rest of Auckland. Schools will be reopened. You're able to travel to other regions. You must, of course, still wear face coverings on all public transport. There can be no more than 100 people at social gatherings, including weddings, birthdays, funerals, tangi and church services. Businesses can reopen, but must follow public health rules, including physical distancing, record keeping, and the usual cap of 100 people. Hospitality businesses can open, but must apply the 3 S's. People must be seated to prevent spread. There must be social distancing between people and tables, and each table must have just one person serving it. As long as all public health measures such as basic hygiene and contact tracing are met, weekend sports can proceed. But as ever, if you are sick, please stay home. This continues to be one of our most important messages. What we are, of course, trying to do with these restrictions is minimise the risk of any transmission and be able to rapidly track and isolate any cases, just in case. There is every chance we will find further cases. While our expectation is that these will be linked to our current cases, we still need Aucklanders to follow the level 2 rules, especially over the weekend, so that we can get the extra assurance we need to get back to level 1 as soon as possible next week. I appreciate that for some, level 2 over a weekend feels like an imposition. But what we know and what we've learnt the hard way is that mass gatherings, which tend to happen over that period of time, pose the greatest risks when there is COVID in the community. Things like church and social gatherings have often seen the most significant spread. It has always been our approach to move down one alert level at a time in order to test the decision we've made and ensure it is safe to go further. And while we believe this to be a small contained outbreak with the evidence that we have to date, we also know that there is, of course, the risk with it being the new variant of it being more transmissible. And so we're adding that to our cautionary approach. But again, the biggest urge I have is to tell everyone in Auckland and across the country, if you're sick, get a test and stay home. Ultimately, it is because cases A and B got tested that we are able to move down alert levels today, and we want to thank them for their actions. I'd also note that as a result of the decision to place Auckland into alert level 2 until Monday, all Auckland businesses who meet the criteria will be eligible for the new COVID resurgence support payment, passed under urgency in Parliament this week. As a quick reminder, the payment is available for businesses who have experienced a 30% drop in revenue over a 7-day period. More details are available at covid19.govt.nz. And so finally, once again, thank you for everyone for all of your work to date. We ask you to just keep up your enormous efforts. We're happy to take questions.
Prime Minister, with so many outstanding test results, particularly from the school, how are you so confident that this is contained?
Keep in mind, we have completed the testing of those close contacts, and that's where we've seen those that extra positive result from that classmate today. The remainder are what we call casual contacts. And so those are people we don't have at this stage any reason to believe are likely to produce a positive result. But even then, all of that group have been asked to stay at home. And so despite this alert level change, will not be leaving their homes.
Given that this would have spread a lot if we hadn't gone into the level 3 lockdown, was the level 3 lockdown necessary?
Yes, it was. Look, we absolutely stand by, even with the information we have today, the decision to move to alert level 3. We were dealing with a scenario where we weren't clear on the origin of the original case. We also have learnt that it was the more transmissible virus. So we wanted to make sure that we took a cautious approach, because it's much, much better than getting it wrong and having a large-scale community outbreak in a long lockdown.
Can you guarantee? Can you
Sorry,
dinner is everywhere.
I have done that to you twice this week. Forgive me, Gina.
Given the shift down alert levels, can you guarantee that we're not going to end up yo-yoing back into higher alert levels next week?
And that's, look, the reason we've taken the decision to move to alert level 2 is because it has still a level of precaution in it. We do worry about mass gatherings, and so that's restricted here. It still asks hospitality to keep precautions in place. And I believe the reason that Dr. Bloomfield was recommended that we do this is because it still gives us a period where we could just reassure ourselves with a few extra precautions in place.
Should other regions in the country be concerned about Aucklanders travelling into their areas?
No, we've always asked Aucklanders to think about their behaviour when they move out, to take their level with them, and we still ask them to do that.
Are students at Papatoetoe High School being tested a second time or being asked to come back for retesting? There's a Facebook post from the school that suggests that.
So the ones who will be retested as part of the protocol are those who were the close contacts. So the classmates of the original case and the teachers that interacted with that class. So they have a 14-day isolation period. Every student will have had to have had at least one negative test result, remembering that the testing for the students started from day 5 after the exposure event, which was last Wednesday, so that's reassuring. So we're quite comfortable with all the negative test results we have. Anyone who develops symptoms or who wants a second test can do so over the weekend, and every student and staff member will need at least one negative test before they return to school Monday.
And how much stock, or how much, I suppose, reassurance has been given by the wastewater testing in terms of the regional signals that it gives you?
So it's one element of the sort of reassurance, not just the testing this week, but the previous testing as well, which provided us with perhaps some confidence that there wasn't widespread community transmission. if there was any transmission, it might have been more local. I should say that there's an extra testing site that is just covering the Papatoetoe community, and that result is due back either later tonight or in the morning. So again, that will provide us with some further information.
That was a testing site that was specifically added just for this purposes of this particular outbreak.
Prime Minister,
Okay, Jason then Henry.
was there any thought to jumping down to an alert level 2.5 or something in between where we are now and level 2?
So we are continuing to ask, as part of this, of the order that is being prepared, we will be asking the rest of the country to keep up the mask use on public transport. So I should add that. That is an additional element. Otherwise, we're moving to a straight level 2. But keeping in mind in previous iterations, when we've had a 2.5, it's often been the addition of something like mask use, which we've now added in the orders already. So now in Auckland, we are using them as a matter of course. Look, actually the debate was more less so around whether the level 2 settings were right, because by and large people felt comfortable with that. It was the length of time and whether or not we could afford to move further. But we chose the balanced and cautious approach.
And just on that length of time, was there a specific order made to have it over that 7-day period as opposed to the night before, so businesses could get that subsidy that the government's
Primarily, we wanted to make sure we had enough time at a cautious level to give us a bit of extra reassurance. The second reason, of course, it's a natural decision-making point for us is the cabinet process. Thirdly, if we want to take a cautious approach, we should do it over a period where there are generally larger gatherings, and in Auckland over a weekend. And so those featured. We were also mindful, of course, that if we were getting right close to the cusp, we would rather have people eligible for the payment than not. Audrey.
Can I clarify on the mask?
Oh, sorry, I said Henry, didn't I?
Prime Minister, you were saying you would still make the level 3
I will
decision
come to you.
on Sunday, even with the information you have now.
Yes.
That's correct. Are you absolutely confident about it? Because this shows every appearance of being a case of leakage with no might have been the outbreak.
You've been speaking with Rodney Jones. So what and I respect the analysis we've had from Rodney has always been excellent. So Rodney's descriptions there, of course, are an outbreak being more like what we saw in August. Leakage is, of course, his way of defining the idea that you've had something that's relatively contained and we've caught it in close proximity to the time at which it's occurred. So what I'm saying around do I believe we made the right decision? Absolutely. On the information we had, absolutely. I'm pleased we did it. And now I believe with the information we have, we're ready to move to 2.
Would level 3 have changed anything about this, what's happened in the last couple of days? All these people in the high school would have been...
I guess the point is at the time you make the decision... I guess the point is at the time you make the decision, and keep in mind the information we had at that time was we had someone who was deemed to be, yes, working at a border, in a border area, but a low risk environment where it was seen as less likely to have been able to pick up COVID through their place of work. So it was really incumbent on us to make sure that they hadn't picked it up through some other community channel and that it hadn't been circulating for some time. I think everyone would agree, much better to have 72 hours than make the wrong call and have 72 hours of a community outbreak unchecked.
So mask use on public transport
Yes.
will now be mandated across New Zealand.
For now. We're keeping it in for now. We haven't made a decision about whether or not that's going to be a long-term decision, but for now we would like just to keep it up in other parts of the country for now. Audrey, sorry.
Dr. Bloomfield, can you just clarify the locations of interest for case D and E? I mean, are there many of them? And I thought you said they're not infectious. They weren't infectious when they went to them. So
they were asymptomatic.
So the infectious period. So cases D and E were tested on Monday as part of the testing for the high school community. So the infectious period or potential infectious period is categorised as the 48 hours before the test was taken, so that does include the weekend. There is a handful of locations of interest. The details of those and the timing that they were there is just being finalised and will be available at any time this afternoon.
how many? And I mean,
a handful, as far as I'm aware. Yes.
Audrey, I think the reason that Dr. Bloomfield has given that context of, while we're of course releasing those areas, places of interest, the point that's being made to us by those who are experts in the area is if you are asymptomatic, the likelihood of you being of transmission is, of course, much, much lower.
How confident are you?
Yeah, okay, I'll come here and then over to Gina.
On the nationwide masking on public transport, that's been something that's been bubbling away for some time now. What would your thinking be if you were to remove it now, given that there's been...
We didn't, look, at this point, we've obviously always made the decision that we would have it in place for Auckland. At this present point in time, the decision was that we would keep that consistency for a time, out of that abundance of caution. I don't want to preempt a decision. A longer decision over whether or not we'd keep it in long term wasn't had. It's likely that we'll have that down the track, and potentially at the same time that we discuss QR code use, because that's something Cabinet also wants to discuss later.
You mentioned in the House that you were going to, the Cabinet would discuss mandatory QR code scanning. When do you, is there a timeline for that?
Once we receive advice. I mean, I think the issues have been pretty well traversed. The thing that I think we all accept is if we do go down that track, enforcement's going to be tricky. And so we're always cautious about bringing in things that we say we're mandating something, but we're really relying on people just to do the right thing. And so we've got to think through all of that, because people, if they know it's compulsory, you really want to see the uptake high at that point as well.
Have you heard whether Have you heard whether one of today's cases works at McDonald's in South Auckland, and if so, what risk that poses?
Yes, one of today's cases does work at a McDonald's, and we're just confirming the details of exactly when that case worked there, and of course the nature of the role that the person had will relate to the potential risk. What I'll just emphasise is what the Prime Minister said and I said earlier on. In fact, this case has not had any symptoms throughout. It was asymptomatic when tested, and indeed was asymptomatic during the weekend period.
But given the potential for so much person-to-person contact working at a McDonald's, did that have any bearing on your decision today?
We certainly knew that information, that this case worked at a McDonald's, but we were also, the early information we had about the length of time that the person was at work and the nature of the role there was something that we took into account as well.
All of this featured in our thinking. And just remember, of course, Level 2 is designed to have situations where we are contact tracing individuals who are casual contacts or close contacts in the community in an environment where people are not staying put full-time. Level 2 is built for that. It is built with the idea that you may having to contain cases at that level.
Which McDonald's is it in South Auckland?
I don't know exactly, actually.
All of that detail, I imagine, will be out in fairly short order.
Yeah,
one of the suggestions...
I imagine well before you go to broadcast, we'll have that information with you.
One of the suggestions to reduce New Zealand's risk profile during this most risky period is to reduce the number of international arrivals overall. Australia has done this. So a couple of questions. Do you have any appetite to explore this in beyond your tweaks? And second of all, would you have a legal basis to do that without breaching your rights?
What has been raised with me every time the issue of reducing the risk profile by having a smaller number of booking spaces has been that we would run the risk of being challenged over whether or not we were impinging people's ability to get home. And so that is a factor that we think about. It is already pretty tough. You know, they book out quite quickly and people are having to book a long period in advance. One of the things that's reducing the risk profile in New Zealand is the fact that we do have a significant number of Australian returnees where the risk profile is much lower. And so previously, I haven't looked at recent numbers, they were sitting at about 40% of those who were in our facilities. And so, again, that makes a difference to the overall risk. Another thing that's reducing the risk profile is that the testing pre-departure, we've seen a steady decline in the overall rate of infections coming in. I believe I saw analysis that's saying since September it's really started dipping back a bit. And that's in line with some of the transmission patterns we're seeing overseas.
So no goals to reduce the number?
Not at this stage, no.
Dr.
I'll come to Jessica just for the...
Dr. Bloomfield, just to follow up on the McDonald's question, when you said the nature of their role, do you mean that they didn't have a front-facing, public-facing role? Is that what you mean?
Look, all the details will be released, but we certainly we have some information about the nature of the role, and that was helpful in terms of the decision, but we will release that information. What I do want to say, and I make no apologies for this, is It is important that we have had the opportunity to talk with the employer because they need to make arrangements for other staff members and ensure that that is all in train before we make a public announcement about anything like that.
We're talking a matter of hours, but I think what's most important is, of course, we had this information at 3:30 when we made the decision. Yeah, sorry, I'll come to you, Jason.
You said that the Ministry of Health and Dr. Bloomfield had advised and you agreed to moving down to level 2 and level 1 respectively. Was the advice about the time frame, was that accepted as well in terms of Monday?
Yes.
So it was basically a blanket agreement?
Perfectly aligned.
Was there any discussion in Cabinet, any disagreement?
Oh, as I've indicated, some of the discussion was when the review period for level 2, pretty solid consensus around the movement. But a bit of a discussion over, were we confident enough to move a little further? When should we have the review period? These are good discussions that we have as a team, and I think it means that we really traverse all of the issues. But overall, everyone totally comfortable with this outcome.
Yeah. Minister directly criticised some of the countries leading epidemiologists yesterday.
So what was
Minister
that?
Hipkins, he directly criticised some of the countries leading kind of media epidemiologists yesterday in general debate. He said that they should stop talking about border failures because this made it harder for them to hire and retain staff at the border. And do you endorse those comments?
Yeah, I just to be fair to Minister Hipkins, I think what he's trying to say is when we have an issue at the border, that's often a result, of course, of the fact that ultimately it is very, very hard not to have any circumstance, and you see other countries, Australia, experiencing the same, where the virus never ever emerges. And so I think the point that he was trying to make is that we have humans involved here who are doing their best every single day. We try and put layers and layers and layers of filters to try and pick up if there are any issues. But we are very careful not to try and lay the idea of failure or blame at the feet of individuals. And so I think he was pointing to that language being a bit tough on those who do a very hard job.
We've seen some kind of leak from the border, or seemingly from the border in this case, every month or so, quite a while now. Is that kind of just going to be the case going forward? That you can never have a perfectly watertight system?
I think it is. I think it is absolutely fair to say that with a virus, perfection is very, very difficult. But what we can have are these layers. I mean, at the moment, when you think about the hypothesis for what has happened here, given we haven't traced anything beyond the place of work, that place of work was deemed to be low risk. And yet here we have this case. And so I think, again, it just demonstrates that this is a tricky virus and people are doing the very best they can.
You worry that there might be quite a lot of complacency after people get vaccinated, especially with the first dose?
That's going to be something we have to be careful about. All of the comms I've seen to our frontline workforce are very clear. This vaccine now means that we are protecting you as a person. It does not mean that you will not be able to pass COVID on. So all of the other protections need to stay in place.
New Zealand has now had experience.
Oh, sorry, and then I'll come to you, Jane.
Will people in the high school community be subject to a public health order instructing them to isolate, or is this sort of a nice have?
So we contemplated that, and it's certainly a tool we could use. However, what I would say is, and as I said in my comments, the school has been incredibly supportive and cooperative around the measures to date, and with the expectation that students require a negative test before going back on Monday, and the support that can go in to support that school community, we didn't feel that an order was necessary to achieve what we wanted to achieve, and so we'll be working closely with that school community to achieve the outcome we're after without an order.
Given the Marist College cluster was the second largest we've seen in the country, does that give you any pause, or does that inform how you respond here?
Yeah, of course, keeping in mind there were a number of factors there around events and so on that really exacerbated the spread within that community and the length of time we had, so the circumstances there were quite different. Even then, if you look at the approach we're applying, it's still very rigorous. The school will have been shut down for a week. Everyone has been required to be tested, even if there's no suggestion they've been in contact with the students in question. 2 tests for those that are considered close contacts from the classroom. And so, of course, applying a really cautious approach, and we're asking those families to stay in isolation longer than others. Jane, and then I'll come back to you, Audrey.
New Zealand's experienced now the UK and South African variants, what have we learnt from it? And is it counter to the experience in other countries? You know, obviously transmissibility being the main one. And has it changed the way we deal with it?
So on the whether or not it's changed the way we deal with it, absolutely, but at the same time, we have evolved our approach generally. But off the back of these variants, and since these variants, things like the pre-departure testing, day zero testing in our managed isolation facilities, so now essentially someone who comes through is getting tested 4 times. People aren't able to leave their room till they return a negative test. Once they go into the tail end of their isolation and have their final test pre-release, they then can't leave their room. And so all of that's been put in place, additional analysis of some of the ventilation systems, booking systems and some of our MIQs for anyone, for people who previously may have moved a little more freely for exercise. All of that is part of our tightening up of our regime and from learning things. As for this case, I'm not the one to comment on that, so I'll have Dr. Bloomfield offer up a suggestion.
I think there were two things, of course, that we know about. Well, one we know for sure about these 2 variants. One is that they are more transmissible, and that absolutely informed our initial advice, and which to use a level 3 approach in Auckland. The other thing that we're, which is, I guess, modifying our response, is the suggestion that they may have a shorter incubation period. And so it really demands us to get in quickly with identifying contacts, isolating, and then subsequently testing them. So that's, I guess, I think our contact tracing has continued to improve, and we've seen again in this instance, our ability to identify and isolate people and then follow up and get the testing done at the right time has been really good. So
it's surprising though that the 2 instances haven't been more infection or created bigger outbreaks.
I mean, this is actually an interesting point that Dr. Verrill has made in one of our meetings. Because of New Zealand's environment, we're seeing basically the R value in single households or single clusters, whereas of course overseas you amplify that by a large outbreak, and the R, an R value, and it's in a perception of that infection is much larger. So Dr. Bloomfield will have to remind me, but it might mean that you're going from average of passing it on to 1 to maybe passing it on to 3 with a more infectious strain. I forget the numbers.
Yeah, our value is generally about 2.5 with the older variants, and they think if it's 50% higher, that would go up to 3.75.
Yeah.
But the key point here, it's an average. And as we've seen here, and if you look at even the original studies, most people don't pass it on to anybody else, even in a household.
Yeah.
And we saw this in the Northland case, where even the very close household contact didn't get infected. Whereas there are some individuals who seem to infect other people without even having been in the same room as them. So this is what pushes the average up to maybe 3 or 4, but there are some individuals that will infect literally dozens or even hundreds of people.
But on average, we're talking 1 person infecting 3. So even though it's more infectious, or more transmissible, that's the kind of on average numbers I think that we're talking about. The one other thing that we're looking to change, as we've said, we're going through the order, and because the assessment was made over the likelihood of someone being at risk based on human-to-human contact with those who might be returnees or airside. Given this latest situation, we're now looking at even those less likely, lower risk scenarios of someone who's not even near someone at high risk, but might be just near items.
So
Finite. And so in this case, as much as it's been described as unlikely, we're now looking at orders that would cover, for instance, laundry, or those who might be in the same workplace as others who are part of an order.
So compared to any other, what would that mean in terms of changes to what people would have to do? Is that the extension of testing to areas like that, or is that other specific?
So it would be, the order would cover testing, but actually it would also mean we were picking up those groups for vaccinations as well.
Compared to any other alert level decisions?
Oh, so Audrey, yes, and then I'll come to you, Tova.
Yeah, can you please reassure people that they do not have to give their immigration status before getting a test, and that once it's taken, their details are not passed on to any immigration authority?
Thank you for the question. When someone is tested, we absolutely do not check your immigration status. We do not check your legal status. That is not information we're interested in. We do ask for a health number, but we have ways of dealing with it if that is something you do not possess. we need testing to be as accessible as possible, and so I want no one to have any fear that there will be any repercussions for them other than gratitude if they go and get a test. The same case will apply for vaccines.
Compared to other alert level decisions that you and the Cabinet have had to make, how much did this one weigh on you? Does it get any easier as you go along?
Oh, actually, there are some where, particularly if you've been in an alert level for a long period of time, where you've had multiple outbreaks, where some of the decision around the edges around limitations on gatherings, 2.5, things like that, just getting those settings right. But actually, the more often you deal with cases, the more assurance you get that the system is working, that the contact tracing is working. Things become not predictable, but there is an order to almost the way we use our alert levels, and so you get a bit more used. All of New Zealand's getting a bit more used to it, and so no, this decision to me felt like absolutely the right one.
Can you just confirm something you said in the House? Was it the 3 initial cases? None of them were using the COVID Tracer app?
No, sorry. What I was trying to say was that my understanding was that they had not scanned. So you've heard Dr. Bloomfield talk. I think he may have talked before about some of the other functionality, but my understanding was that they did not use the QR code for scanning, but we were still able to compile the places that they had been, obviously, without those scans.
And how can you be so confident in that you've picked up everywhere that they've been if they haven't been
scanning? Because we use other information as well. So, for instance, people are very forthcoming in providing details from their bank transactions, which are actually a really helpful prompt for when people have visited supermarkets and trade stores. We can see from those details. We can see from people's work records where they have been. So we have a range of prompts we can use that help remind people where they've been.
So I think the other thing here is, even though they hadn't been using the app, actually one of them had the app and had the Bluetooth turned on, so that was helpful, and we were able to identify some people from that. But once we knew the venues they had been, we were able to send out a notification to other people who had scanned in using the app, who were there at that same time. So it's helpful for everybody to scan in, even if the original case
what
hasn't
about,
been scanned.
what about these 2 new cases? Have they been scanning?
Still looking for that information.
With the human rights report that came out today, showing that Tangata Whenua, Asians, Chinese, Pacifica and Asians have been discriminated against during COVID-19 outbreaks. What statement would you like to make as a government with regards to that?
I couldn't speak to any of the specifics, unfortunately, with Cabinet in the House. That's not something that I've had too much close contact with. However, we were very mindful throughout the lockdown in particular of the disproportionate effects that COVID-19, and unfortunately has been proven, to have on our Māori and Pacific communities. And so that's one of the reasons overall we've taken this strategy as a country, is to protect the health and well-being of all New Zealanders, including our Pacifica and Māori communities. The other thing that we've done is try and work really closely with community leaders to identify where there's been need for social support, for those who might be rural and isolated, whether or not it's being whānau ora, providing care packs and hygiene packs, or working with marae, or simply iwi and hapu who had the means to reach into communities but just needed an extra bit of support to do it. So right from the beginning we have been trying to do that. We won't have been perfect. And I think in an emergency situation there will always be things you can improve, but it always has been top of our mind.
That lack of scanning seems really problematic because memories are fallible. So can you rule out there not being a whole raft of other places that these people visited that aren't on the list?
When you say these people, do you mean
the people who haven't been, the cases who haven't been
case
scanned?
A and B? Well, look, you can actually see, obviously, when you travel somewhere specifically for the purposes of having a bit of family time together, you can see that there's an order to things with their car trip and then their visits and so on. And then with some of the others, we've used EFTPOS transactions, so you can see why there's quite a bit of precision. And we add an extra half an hour either side, I think it was. We add a bit of time either side in case there's a failure in memory, just to have an extra bit of buffer.
So you're totally confident you know where all of these cases
Oh, look, we never entirely want to rely on memory, and we never entirely want to rely on bank cards. That's why we ask people to use the app. It's why we ask them to turn on the Bluetooth and keep scanning. It's really important.
What percentage of
we'll finish up quite soon, but Janae.
Yeah, the Ministry of Health identified 128 close contacts of the cases A, B and C, the original 3 cases. How many of those test results have not come back yet?
Of the close contacts?
Of the close contacts. Yes, the only ones that are not back yet was there were some people who were in the waiting room at the same time as KC, who was the father in that family. Most of those are back. There are some who are not, but actually this is an interesting one because the initial positive test result on that case, KC, has subsequently come back negative 2 times, and the first result was a very, very weak positive. Still being treated as a case, still being followed up as if it was a case, but we believe the risk here, and indeed because it was right at right near the beginning, if even captured by his infectious period, the risk to be very low. But those are the outstanding results. They will come through.
He also had negative serology as well, so he baffled us for a while.
Are you satisfied with the timeline for these tests? I mean,
I was actually going to take all 3, Henry, so I'm still going to do that actually, just to try and get a little bit of discipline going.
Yes, that's serology. So what percentage of Case B's workmates actually have undergone serology testing?
All of the close contacts?
Just Case B works in the laundry section of the employer of the Sky Chef with 9 others. They have all tested negative on a PCR test and have had negative serology. They haven't done serology on the others in the workplace, but all the others have been tested, and again, the majority of those results are back and continue to come in.
They weren't considered to be close contacts either, as I understand.
No, none of them were close contacts because actually she hadn't been there while she was infectious. It was really just looking to see, was there any other person in the workplace that was currently infected or may have been infected in the past.
Okay, we'll finish up with one last question. Thomas.
Prime Minister, if the last Auckland lockdown had looked like this, the August one, if the cases come back looking like this, would you have made the same decision, or are you getting to know the virus more and getting more comfortable with the systems that manage it?
I will never be comfortable with COVID-19. There is an indescribable anxiety that comes with the daily grind of managing a pandemic, and I think we all feel it. But you do learn things. Undoubtedly you learn things. With that first outbreak, though, in many ways it was vastly different. I mean, the first part of it came at an alternate workplace to where we even found that those index cases really were. So a very different scenario, and you can see that by the different stages we're at now with this one. We make the best decisions we can with the information we've got and with the best advice that I can imagine having. So the decision we've made today still has a level of caution in it, and that gives me a level of comfort. Thanks, everyone. Thank you.